Better health. Kalpana Adhikari suffers from pancreatic cancer and has recently had an operation. She's travelled from Calcutta in eastern India to Mumbai for surgery. Treatment has so far cost her the equivalent of 3,000 euros. Kalpana and her family share a room at a local charity. But while the emotional trauma she's facing is hard, her financial worries are bigger.
We've already borrowed hundreds of thousands of rupees on treatment and other expenses. Now I'm starting 3 rounds of chemotherapy. I think we'll have to borrow even more from friends and family in the coming weeks and months.
Millions of Indians share Kalpana's fate because they don't have access to quality healthcare. That could now change with a national insurance scheme dubbed Modicare after the Indian Prime Minister. Poor Indians could receive up to 6,000 euros worth of coverage annually. But would that mean that they can walk into private facilities that generally serve India's rich? There's one problem, says the managing director of Wokhard, an upmarket South Mumbai hospital.
The procedures have to be provided at XYZ costs. And those are the prices which are really kind of putting everything in a very kind of constrained manner, because our current cost structures are greater than the prices that we're going to get reimbursed for the procedure.
For private hospitals, the problem will be reconciling how much they usually charge with the government's mandated rates.
The rates which have come out in the first instance from the government do not probably allow them to make the kind of profits which they have been used to making years together. So that is their apprehension. But you see, on the other hand, India's healthcare is also in hands of public sector hospitals, which are going to be allowed as part of that scheme. It's also to do with these small nursing homes.
Prime Minister Narendra Modi unveiled his plan recently to coincide with India's Independence Day. He hopes that after some testing, it will be open for business on the 25th of September. Modicare hopes to bring medical insurance to more than 500 million people across India. To its critics, it's a scheme that's too big to succeed, mainly because of its scale. To its supporters, it's a step in the right direction. Mr. Modi would hope that many more Indians think the latter. He's up for re-election in just a few months from now. With mounting medical bills, that wait cannot end soon enough for Kalpana.
We spent much more on the treatment than I thought. Will we get some assistance from the government? Well, that would really help us.
As the Adhikaris wait for more news, they hope that Modicare would provide a window of opportunity to them.